Hi, everyone. My name is Savannah Peters, and welcome to my capstone, The Educated Citizen presentation. First, I'm going to talk to you a little bit about the public issue I chose, which was breast cancer screening and early detection. A little background are breast cancer is the second most common cancer among women in the United States and the most common cancer among women below the age of 40. In 2019, there were over 270,000 new female breast cancer cases that were reported to the CDC. The numbers continue to trend up for breast cancer in the ages of 20 to 40. However, the recommendation of beginning breast cancer screenings begins at 50 years of age unless you have um, a higher risk of being diagnosed with breast cancer, whether it is due to family history or having the BRCA1 or 2 gene mutations. Um, and the reason why I chose this is because breast cancer has been very prevalent in my life, personally and within my family. My grandmother was diagnosed at 37 with breast cancer and is now a 40-year breast cancer survivor. I was diagnosed this past December at the age of 31 with triple negative breast cancer. A former classmate of mine was diagnosed 3 weeks after me at the age of 30. um, my aunt passed away at the beginning of 2021 due to metastatic breast cancer. And my youngest cousin was recently told that she does, in fact, carry the BRCA2 gene mutation at the young age of 25. So, having knowledge and education to available breast cancer screenings, especially at a young age, increases the chance for early detection. And it is just something that I'm extremely passionate about because of my personal experience. Throughout my time here at Nebraska Methodist, we were instructed to complete various writings for the educated citizen that touched on being an effective communicator, a reflective individual, and a change agent. So I'm going to go through a couple of my experiences, what I learned from them, and how I can kind of tie them to my public issue that I just explained. So, my first experience of being an effective communicator happened when I was at Women's Methodist Hospital in labor and delivery. I was with my first patient that was having a vaginal delivery, and it was my first patient that, had consistent fluctuating pain. So there was a lot of communication that needed to go in with that, a lot of nonverbal, a lot of verbal. Throughout the day, I knew that my priority was going to be her pain management until the delivery was finished. And so I would just kind of use cues from her and talk through the pain and where it was and what different therapies were helping. Um, what I learned from this experience was that there are many ways to be an effective communicator, not just by verbally talking to your patients, but with nonverbal cues. Because sometimes when you're working with a patient that is experiencing large amounts of pain, they aren't always able to tell you verbally what they're feeling or if there are that are working. And so just being an active listener and picking up on nonverbal cues um, to help me efficiently take care of this patient were the primary things that I learned in this situation. For applying this to the public issue, I think it's very important to listen to your patients when you go over their medical history. And communicate potential screenings that may be beneficial to them. So, if they have a history of breast cancer in their family, or if they, have a history of like a lump that they've noticed on their breast or something, just kind of giving them the resources to find affordable breast cancer screenings within their area. Um, because essentially that is going to lead to early detection on whether or not they have breast cancer. My second scenario of being an effective communicator was on the progressive care unit at Methodist Maine on 6 North. I was working with a non-English speaking patient. I was helping her manage her nausea and vomiting throughout the day. One of the GI doctors and a surgeon came in and mentioned that they were going to do a resection and possible ostomy. I don't think, based on when I walked in that room afterwards, that she, seemed really uneasy and concerned about the procedure and didn't really know what it was going to entail. And so I worked with an interpreter on Marty to kind of gather that she was feeling uncomfortable about that. And so I did call the doctors and surgeons back in with help of my RN. To further explain that, because she just wanted some more time and to not do it that day. And even essentially, it resulted in her moving that procedure to a different day. That way she could inform her family and kind of let all of that uneasiness kind of settle. What I learned is that it is very important to have effective communication, especially with those that have trouble understanding situations or that do not speak the English language. It is very important to slow down with these patients and use all of the available resources that you can, and get help if you see fit. And a way to apply this to a public issue is to, once again, use translation resources when communicating with people that speak another language. Make sure that learning materials are not only designed for people that can read English, but for people that can also that may not be able to read English and read other languages. My first reflective individual experience was when I was in Nursing 200 and I was at Deer Park Elementary working with the Children's Hospital Vision Program. We screened nearly 400 kiddos for various eye diseases and then referred them if they were, predisposed to these conditions. And I really reflected on this afterwards because it really hit me that some of these kids, this is the only time of the year that they are able to have an eye exam. And so it just kind of, hit me in a different way that our clinical experiences are sometimes the only resource that some people have. And what I learned was that we, in our clinical experiences, have opportunities to work with underprivileged individuals, and that, really reflecting on this helps me understand that there are a lot of populations that lack access to resources. And so it's very important to listen to your patients and talk to them about potential social determinants of health that they may be facing on a day-to-day, and working with social work and trying your best to, get them these resources. And then applying this to the public issue is that I did find out that 1 in 10 people don't have health insurance. And so doing my my public issue presentation, I really reflected on how I can, do my best to guide people to these available resources if they are having trouble finding them or accessing them. My second experience of being a reflective individual happened during Nursing 400 when I experienced my first patient death. I worked with my RN, and he explained to me very thoroughly about what we were going to experience, what our priorities were with comforting the family. And I knew after that experience that I really needed to reflect on my emotion and how I felt about it, and to not take it home with me, because it was a very sad situation seeing the family hurt and being there with them to try to console them through their loss. And what I learned is that nurses, experience difficult things on a daily basis. And it is really important to sit down and, reflect on what your thoughts were, any attitudes that were, expressed, any emotions or behaviors, because it's going to help you process the situation and can help, either alter your practices for the future or help you guide others with reflecting on difficult situations. And for applying this to my public issue, after I was diagnosed with breast cancer, I had to reflect on receiving that diagnosis and before jumping to conclusions, trying to, navigate my way through the next steps of this journey. And so I think it's just really important for nurses to help their patients reflect on feelings after being screened for breast cancer or with an early diagnosis of breast cancer, because it is very overwhelming. And it's just a lot to digest and reflect on. My first experience of being a change agent was working with a gentleman at Together Omaha. We were providing various screenings. He was a type 1 diabetic and only got his A1C checked at income friendly organizations, primarily at Together Omaha when Methodists went. He asked if he could go back out into the food pantry line because that was the only way he was able to get his groceries. And so, of course, I accommodated to him. I told him that I would come out with his results and any information that I had, that I didn't want him to miss out on his groceries for the week. And what I learned is that it is very important to advocate for your patients and provide them personalized care. You may see patients that have similar diagnoses and require similar treatments, but having that personalized care can really aid in their progression with that. And I just think that it's very important. And that also ties into application for this to the public issue, that helping, lower social economic populations access affordable breast cancer screenings and giving them all the information and knowledge that they need. You can really make a big change with that. My second change agent scenario was not really a clinical experience, but more with my grandma. We did a home healthcare project, and I found out that older adults have more of a chance to be readmitted to the hospital if they don't take care of themselves. And so I really worked with her on creating a vital station because she has hypertension and diabetes. And so we kind of worked with that. I made a huge change in her life, and she continues to, track all of that stuff and, decrease her chance of falling or being admitted to the hospital. And that, with the public issue, my shared experience and talking to my cousins pushed my youngest cousin to be tested for her genetics, which did result in an early detection of her being a carrier of the BRCA2 gene mutation. So now she can start her screenings early. So all of these experiences through my time at Nebraska Methodist, they've helped me become an effective communicator, reflective individual, and a change agent. And it has really resulted in my success of becoming an overall educated citizen. It's not only going to help me grow as a better nurse, but as a better individual. And I'm going to take this with me when I go up to Mayo Clinic and, educate people about how important early cancer screenings are and early detection is. So, thank you for this opportunity to give you my presentation. And it has been a great time here at Nebraska Methodist College. Thank you.